There is an increased pressure on consumers worldwide to look good, but the costs are also taxing. And in the current economic climate, where are some of the places to go and look good for less? Joining us to talk about this and other trends in medical tourism is Faith Cartwright, founder and director at Medical Tourism South Africa. And also joining us is Piri Harrington. Good morning to you, Faith. Lovely to have you this morning. Looking better and trying to look for places to go. Maybe tell us, as being from the Medical Tourism SA, who exactly is coming to you and what type of treatments are they seeking to get?
Good morning. Thank you for putting me on the show. First of all, the treatments, the people coming to from various countries and from Nigeria, they're really focusing on cosmetics. And then around the world, the US, the UK and Australia are predominantly coming for fertility treatments. And I think fertility is the whole of Africa.
Beth, I want to ask you, is the cost, especially having a look at where the rand's gone, have we seen an increase in the number of queries you've gotten as the rand has decreased, and obviously it's getting cheaper for foreigners to come locally for these treatments?
It definitely has increased. With the rand being so weak, I think it's heaven for people coming from America and the UK, with the pound being almost 20-1. As well as in African countries, they pay with the dollar. So numbers have definitely increased. But there are other downfalls, unfortunately, such as visas, which has lessened the numbers, unfortunately.
Faith, I want to come back to a point that you mentioned there on fertility treatments and saying that your clientele is coming from other African countries. That seems to be a growing part of your business. Maybe what is the rationale behind having people from other parts of the world coming to South Africa, and looking at the standard of our doctors here, do they meet global standards in terms of being able to deliver that service?
Well, Medical Tourism South Africa actually assists the patients from the beginning when they make an inquiry right through to finding. Unfortunately, many people need to have egg donation nowadays because the ratio is 1:5. Women in Australia cannot conceive a child, so that's a huge marketplace. And so those treatments cannot be performed in the UK and Australia. They cannot receive egg donation, so they're looking at going elsewhere. And South Africa is definitely a popular destination for that, not only because of the currency, but also because people don't really want to go into a fertility clinic and bump into someone they know. That's a huge thing in Africa because of the African culture and the stigma around not being able to conceive a child. So you find Nigeria and Angola, they come to South Africa because they're too scared they'll bump into a friend, and then they'll be aware of their infertility problems. There's also another problem that in some African countries, in Southern Africa, there are no fertility clinics. So, for example, Zimbabwe, Botswana, Mozambique, Malawi, Zimbabwe, there isn't a fertility clinic. So if you're struggling to conceive, you have to seek help in another country. And South Africa being close proximity, it's quite easy for the African people to come here.
Faith, when you look at
Sorry,
Faith. When you look at the cost of fertility compared to other parts of the world, where do we come in? Where do we rank?
Well, it's a huge saving. In South Africa, the average treatment for egg donation varies between 85 and 95,000 rand. That's based on no complications and just the standard treatment, and that's for a whole harvest. So the lady that donates her eggs, she'll give you every single egg that she produces in that cycle, whereby if you go to America, you're looking at about 200,000 rand, and that will just be for 2 eggs. So if you don't succeed on those 2 eggs, you'd have to pay another 200,000 rand. So South Africa, definitely, it's low cost with first-class facilities, and it's definitely a growing market.
Faith, you talked about obviously fertility treatment being one particular part of the market there, but let's talk about some of the other procedures like breast augmentation or whatever the case may be. What other treatments are, not just clients in Africa, but also parts of the globe are coming to you for? And are you finding that clients from different parts of Africa have different needs from the ones that we are seeing outside of African borders?
Absolutely. As I said earlier on, the Nigerian ladies love to come to South Africa, and they get an all-round from top to bottom. So from the face to the breast to the teeth, all round. And they do other treatments such as permanent tattoos on the eyes, lips. And then from Europe, dentistry in Germany is the most expensive. We're about 1/8 of the price in South Africa. So people from Europe, they come to South Africa mainly for dentistry, I find.
Faye, thank you.
And the UK.
Faye, thank you so much for joining us this morning and giving us perspective on medical tourism here in South Africa. It does seem as though if you want to look good, you may want to make your way here to South Africa for that. Thanks to Faye Cartwright. She's the founder and director at Medical Tourism South Africa.